Carlos from BSN 3A, Newman. So today I'm going to perform the Leopold's maneuver. But first, what is a Leopold's maneuver? So these are a systematic method of observation and palpation to determine fetal position, presentation, lie, and attitude. Its purpose is to determine fetal presentation and position and the expected location of the point of maximal intensity of fetal heart rate in the woman's abdomen. It is indicated for pregnant women with 24 weeks gestation and above, and when fetal outline can be palpated. It is contraindicated for women with full bladder because this may obscure the findings. Special considerations are obese clients have thick belly fat, which can also obscure the findings. Patients who are polyhydramnios may give the examiner a little difficulty. However, reassessment and rechecking of another nurse and intravaginal examination can help to confirm the findings.
Firstly, we should wash our hands to deter the spread of microorganisms.
So ma'am, good afternoon. Today
Introduce yourself and explain the procedure to the client.
Carlos, and we will do the Leopold's maneuver to determine the presentation of the fetus. So for the meantime, I encourage you to urinate so that you will not feel any discomfort later.
Flexing the knees relaxes the abdominal muscles. Using a pillow tilts up the uterus of the vena cava, thus preventing supine hypertension syndrome. Then drape the patient to maintain privacy. Warm hands first by rubbing them together before placing them over the woman's abdomen. Observe the woman's abdomen for longest diameter and where fetal movement is apparent.
First maneuver or the fundal grip.
Stand at the foot of the client facing the client. Using both hands, palpate the superior surface of the fundus. Determine the consistency, shape, and mobility.
Umbilical grip, the second maneuver.
Face the client and place the palm of your hands on both sides of the abdomen. With right palm stationary on the right side of the abdomen, the left palpates the left side of the uterus in a circular motion from top to lower segment of the uterus, applying gentle but deep pressure to palpate the fetal outline and small fetal parts.
Third maneuver, the pollex grip.
Gently grasp the lower portion of the abdomen just above the symphysis pubis. Try to press the thumb and your index finger together. This action determines the presenting part and its mobility.
Fourth maneuver, the pelvic grip.
The nurse faces the feet of the client, places one hand on either side of the lower pole of the uterus, then palpate the fetal head by pressing downward about 2 inches above the inguinal ligament. Using both hands, this maneuver determines fetal attitude and degree of fetal extension into the pelvis. Now that we have performed all the maneuvers, it is important to place your client in a comfortable position to ensure safety and comfort. Document procedure and assessment findings and the client's response to the procedure. And lastly, wash your hands.